lot of us have experienced from time to time a cold or runny nose. But for patients with chronic sinusitis, this persists for months, if not years. And a lot of these patients have very poor quality of life. They lose their sense of smell. So what we're trying to do here is to get a better understanding of what these immune changes are so we can better develop therapies to help treat this in patients with CRS. The invention came about through a corporate partnership with a company called 3D Matrix, which is based out of Japan. They license a technology called rhinosinusitis, which is a composition of amino acids. It's a hydrogel that's very unique, that it's a liquid until when it comes in contact with fluids, which it changes to a solid. In the United States, it is currently approved for severe nosebleeds or epistaxis. People were starting to use it off-label and found that it was improving wound healing. So the company contracted with us to try to understand the wound healing properties better.
She has been working on a project with a company already on wound healing improvements, and she just observed something. And I think that's because she is Jennifer. She was able to not be tunnel visioned, but just realize what she observed, that it was very, very interesting.
As trying to understand the wound healing properties, we began looking into seeing if it was potentially anti-inflammatory. Now, this has never been described despite this compound being around since the 90s. But what we found is when rhinosinusitis combines with a mucosal surface, be it the nose, the lungs, or in the gut, that it takes on anti-inflammatory properties and becomes absorbent, and now has the potential to serve as an anti-inflammatory agent for treatments of anywhere in the mucosal lining. Currently, we are very limited in our options to treat mucosal inflammation. Most of us are familiar with the most common treatment is steroids, but these have a lot of long-term negative consequences that patients don't want to stay on for sustained periods of time. With the use of rhinosinusitis, we may be able to control inflammation by applying it directly to the surface of the mucosal site of injury or inflammation, thus preventing a patient from having to go on a systemic medication such as steroids. InnOvate came about when we did our innovation disclosure, and it has been an amazing experience with us. They have been so quick and so responsive. And we actually had our first public disclosure was already scheduled in 10 days, and they managed to get us from an innovation disclosure all the way to provisional patent filing in a 10-day span, which was truly remarkable. First and foremost, I have to thank our amazing patients. Through their donation of their tissues when they're having surgery, this allows us to make the discoveries such as this possible. And along a similar line, I have an amazing team of clinicians that I collaborate with, Drs. Justice, Lobo, and Shapurin, and an amazing longtime collaborator, Dr. Atkinson, who our work together in this invention in the lung was really what has helped us home in on the mechanism that it was anti-inflammatory at mucosal sites. We're truly honored that InnOvate has given us this award, and it's a huge validation for our entire team that UF is honoring the work we do in both basic science, translational, and clinical research, and is really supporting the mission of the College of Medicine here at UF.
Well deserved, congratulations, and keep going, and I hope to hear from you many more times that you have a new invention.